So pernicious anemia is a type of anemia, and we know that any type of anemia is a decrease in red blood cells in the body. But specifically, pernicious anemia can be described as a macrocytic anemia that is caused by a vitamin B12 deficiency that's related to an intrinsic factor deficiency. And so we can categorize pernicious anemia as being a macrocytic or megaloblastic anemia due to the large size of red blood cells that are created with this vitamin B12 deficiency. And so vitamin B12 is crucial for the formation of DNA synthesis in red blood cell production. And without vitamin B12, we get red blood cells that are really large. They are nucleated and they're said to be immature. And our typical mature red blood cells are non-nucleated, and so our body can't really use these megaloblastic red blood cells. But in addition to this vitamin B12 deficiency, pernicious anemia has multiple layers to it, and so it's also considered an autoimmune disorder due to the physiological onset of the intrinsic factor deficiency, which we'll talk about a little bit later. So who's at risk for developing pernicious anemia? So the elderly population is at greatest risk for developing this, but in addition to that, females have a high risk of developing pernicious anemia. If you have Northern European or African descent, you have a great chance. If there's a history of pernicious anemia in your family, if you have an autoimmune disorder, you're also at a higher risk for developing pernicious anemia. In addition to having, if you have any intestinal disorder that affects the absorption of vitamin B12, that could also put you at risk for developing pernicious anemia. And there are three main causes of pernicious anemia. And so the main cause is any sort of condition that's going to cause a vitamin B12 malabsorption. So I like this little picture to the right because it shows three different kind of conditions on their own that could cause a vitamin B12 malabsorption, but they could also work together to cause a malabsorption too. Secondly, dietary intake could cause pernicious anemia if you were taking in a low amount of vitamin B12. So typically vegetarians or vegans do not get a lot of B12 in their diet, and they could be at risk for developing pernicious anemia. And lastly, if you have any surgical procedures that could have targeted the ileum of the small intestine or the gastric mucosa of the stomach, you could be at risk for developing pernicious anemia, or that could cause pernicious anemia. But for this presentation, we're going to focus mostly on the vitamin B12 malabsorption due to the autoimmune disorder that would cause pernicious anemia. So this slide kind of goes over the normal vitamin B12 absorption. So typically, once we ingest vitamin B12 in the stomach, it will bind to intrinsic factor. And intrinsic factor is a protein that's made by parietal cells in the gastric mucosa of the stomach. And so the intrinsic factor binds to the vitamin B12 to help transport it to the terminal ileum of the small intestine. And in the ileum of the small intestine is where it gets absorbed through the epithelial cells. So in the case of pernicious anemia, there is an intrinsic factor deficiency, which means that there's nothing to bind to the vitamin B12 once it enters the stomach, and it can't be transported or absorbed properly. And this is what causes the megaloblastic red blood cell formation, because there is a deficiency of vitamin B12 in the body because it was never transported or absorbed properly because the intrinsic factor was not there. So where does the autoimmune response come from that we talked about earlier? So the autoimmune response is developed through atrophic body gastritis, or ABG. And ABG is thought to be a reaction caused by a long-term Helicobacter pylori infection that is just kind of inflaming and aggravating the gastric mucosa. And because of this infection, an autoimmune response is gradually created over a long period of time. And eventually, this immune system starts to attack cells in the stomach lining by mistake. So what's really important to know about pernicious anemia is that the gastric mucosa is being destroyed through this autoimmune response. And so this is a slide of what an inflamed gastric mucosa would look like. So it's very kind of red, puffy, swollen. You can tell that it's very inflamed, and within this mucosa, not only is it inflamed, but we talked about kind of the cells are being destroyed within here too. And so why that's important is because parietal cells are located within the gastric mucosa. And we talked about earlier how these parietal cells produce intrinsic factor. And so if they're being destroyed, no intrinsic factor is not being made, and therefore vitamin B12 is not being bound to and can't be absorbed without intrinsic factor. So this is an overview of the main points of how pernicious anemia is developed with everything we just discussed. So first, the parietal cells are destroyed that are located within the gastric mucosa due to this autoimmune response. And because they're destroyed, intrinsic factor cannot be produced. And because intrinsic factor is not being produced, vitamin B12 cannot be transported or absorbed properly, and that's when you get the vitamin B12 deficiency. And because you have a vitamin B12 deficiency, your red blood cells do not form properly, and you get the megaloblastic red blood cells. And because our body really can't use these megaloblastic red blood cells, they're destroyed prematurely, which creates a decreased amount of red blood cells in the body, which creates the anemia factor of the pernicious anemia. So the signs and symptoms that somebody would experience if they have pernicious anemia are mainly, the first and foremost one is weakness and fatigue, and that's due to the decreased amount of red blood cells in the body because there's a decreased amount of oxygen being transported. In addition to this, they could experience shortness of breath, headache, dizziness, coldness in the hands and feet, chest pain, a pale or yellow skin color. They could also develop irregular heartbeats due to a decreased amount of oxygen being delivered to the heart. But because you also have this vitamin B12 deficiency going on, individuals could experience some of the signs and symptoms associated with that. So commonly people experience this beefy tongue, which is pictured in the right-hand corner. And that's just kind of a smooth, red, thick tongue. They could also develop GI complications, nerve damage, muscle weakness, bone weakness, and even severe nerve damage, which could be confusion, dementia, depression, or memory loss. And so we talked about earlier how individuals with an autoimmune disorder are at a higher risk for developing pernicious anemia. So I just thought it was important to mention some other conditions that are commonly associated with pernicious anemia. So it's not uncommon to see people who already have an autoimmune disorder developing pernicious anemia, and people with Hashimoto's thyroiditis and other thyroid disorders or type 1 diabetes have the greatest prevalence of developing pernicious anemia with this other autoimmune disorder. And the concept is fairly new and it's still being studied, but research has found some commonalities in both immunoglobulin A and G within these individuals. So hopefully, they might be able to find something common as to why these autoimmune disorders are happening.